A very good evening to you all. Chief guest of the day, Sri Love Verma, Honorable Secretary to the Minister of Health and Family Welfare, esteemed office bearers of Indian Academy of Pediatrics on the dais, executive board members, distinguished guests of the evening, including IMA President Dr. Mathandapilla, President of American Academy of Pediatrics, Dr. Sandra Hasnick, Honorable Vice Chancellor of Kerala University of Health Sciences, Dr. M.K.C. Nair, our own National President 2004, past Presidents of Indian Academy of Pediatrics, senior members, teachers, organizers of this conference, Team Delhi, including our National Neonatology President, Dr. Ajay Gambhir, dear delegates, invited guests, friends from media, ladies and gentlemen. At the outset, may I wish you all a happy and a healthy New Year. May the year of 2015 see many new beginnings and sparks of brilliance. On my part, I am honored and delighted to be here in Delhi and humbled by the abiding faith you have reposed on me. The Indian Academy of Pediatrics has been described in Wikipedia as a unique association of pediatricians in India. Other organizations of medical specialties are often segmented. This association has been able to maintain unity amongst its members. To lead an organization of this caliber is an unparalleled privilege and honor, and I am extremely grateful to every one of the 23,000 plus members of IAP for their trust and faith in my abilities. I am immensely indebted to my predecessors who built this mammoth organization brick by brick in half a century. I take this opportunity to salute them. The very fact that there is an international recognition of our professional organization depicting unity among its members is a magnificent tribute to the accomplishment of my predecessors. The far-sighted vision gave rise to the plethora of action plans, activities and projects spread over the past 5 decades. These programs formed the cornerstone of the mission of the Indian Academy of Pediatrics. I am a humble worker of IAP who toiled at the grassroots level for the implementation of this mission. It is time that we consolidated many of these projects into the concrete action of short-term and long-term. To this purpose of consolidation of IAP activities, I stand here to humbly propose an action plan with 3 major components, namely 1. Mission 2020 to reduce the infant mortality rate, 2. IAP to adopt village, Gaon Ki Baat, IAP के साथ, each branch to adopt a village. 3. The capacity building of pediatric practitioners. India lives in the villages. For creating rapid changes in delivery of services, the new government of India has enunciated concrete program to reach the grassroots level for both rural and urban population. It is time that professional organization of pediatricians of India also raise to the occasion and support this innovative call of social change. Friends, on 28 May 2014, as rest of the Kerala was eagerly waiting for the monsoon rains, a distraught Veeraswamy performed the last rites of his 4-month-old son in Paglur village. It was the 28th infant death in last year in the picturesque Attapadi Hills, predominantly populated by tribals in Palakkad district. In the past 6 months, the people have buried 52 infants. If this can happen in the tribal pocket of Kerala, what about rest of India? The cardinal background of this sad story is about child survival in rural India. Maternal nutrition, attendance at childbirth, childhood malnutrition, gender discrimination, unsafe source of drinking water, and as our Prime Minister keeps reminding us, poor sanitation and lack of access to the clean toilets are all factors that determine child survival, especially in rural India. This sad state of affairs must make our mighty organization contemplate on what we can do to strengthen the health sector in rural area. The current state invests us with enormous responsibility to reach out to the poor villages and their inhabitants in order to prevent similar sad stories of infant deaths. Now, let me first start with Mission 2020 for reduction of infant mortality rate. We are proposing a Mission 2020 by reducing infant mortality rate to 20 by 2020 by revising the earlier target. IAP hereby expresses its willingness to dedicate its efforts and human resources to reduce infant mortality rate in our country, working hand in hand with appropriate government and non-governmental agencies, especially in rural India. UNICEF has estimated the infant mortality rate of India to be 35 by 2020 using the auto-regressive intensive moving average technique. However, acceleration is required, and now it's the time to act. We require a comprehensive approach, including increasing of the coverage of key child survival interventions. Government of India is committed to achieve single-digit neonatal mortality by 2030 and IMR at 27 at 2017. With the vision of our Honorable Prime Minister and the action plans of the Health Ministry as well as the state government, these targets can be raised. Honorable Secretary, Sir, IAP will join hands with the Government of India and make every effort to bring down the infant mortality rate to 20 by 2020. The Government of India has several ambitious projects like Swachh Bharat. The IAP will lend a helping hand to all such government projects. Recently, Government of India drafted the 2015 National Health Policy, whereby 2.5% of GDP will be spent on health care. This was the groundbreaking as an investment in our population. Now let me come to the second action plan, IAP to adopt village, Gaon Ki Baat, IAP ke Saath. The Constitution of India envisaged to transform this country into a welfare state. Article 47 states that it is the duty of the state to raise the level of nutrition and standard of living to improve public health. The renewed agenda of public health in India includes epidemiological transition, raising burden of non-communicable diseases also related to the low birth weight, among many other causes, demographic transition in geriatric population, and environmental cause changes. We still have unfinished agenda of maternal and child mortality. Based on the principles outlined in the Alma Mater Declaration in 1978, there is a need to revitalize the healthcare in India. The great organization of 23,000 pediatricians can begin and sustain an outreach program of reaching out to villages through 350 of our local branches. Each branch adopting a village to begin with. We are also joining a current social movement of adopting a village. This can be a revolutionary action plan, sustainable over years to come. This can be a trailblazing model for the entire developing world. In order to synergize various facets of resources, IAP needs to network using the central and local contacts, political, financial, and professional, to make this slogan, "Gaon ki baat, IAP ke saath," a golden reality. Political resources should be used to the best of the possibility by involving the government machinery and political leadership, local panchayat, as well as local self-help groups. Financial and infrastructural resources may be sourced from government and private funding and other organizations. The professional contribution to the activities in the adopted village must be licensed by the local IAP branch in collaboration with Indian Medical Association, FOXI, NNF branches, and other professional bodies. Now let me come to the third action plan, that is the capacity building of pediatric practitioners. IAP has started the mission Kishore Uday for adolescents, the future parents, and I intend to continue the same. Training of the essential newborn care with the Government of India, the NSSK, and the other related programs, NRP, Advanced NRP, and HPS, will be an ongoing project. No child should die of vaccine-preventable disease, and therefore, immunization training and a good general awareness of GPs on pediatrician will be done on a war footing. For the prevention of diarrhea and pneumonial diseases and the better child survival, we have IAP Mission Uday, which will be accelerated. Nutrition in health and the disease is also been taken in priority basis as IAP Impact Program. Protocol management and consensus statement for the common pediatric problems along with Government of India is being planned. This will be a boon to the pediatric residents and GPs. It is also to standardize treatment. To contribute to the redressal of the burden of disabilities, I intend to initiate a committee on disability from this year. Online certificate courses in pediatric specialty is on unveil and already started off with rheumatology. Rational antibiotic therapy, including management of tuberculosis and webcasting program initiated by immediate past President Dr. Vijayavile, will be continued in right earnest. National Task Force on Non-Communicable Disease is also planned. Quality pediatric care, which is beneficial to each child, is another of my action plan. My plans to the 23,000 pediatric colleagues. Family benefit scheme. Anything can happen to any one of us at any time, but family should not suffer. I will promote family benefit scheme of IAP to the maximum. IAP Women Wing. The lady member